As concerns over COVID-19 change many of our day-to-day activities, some people have questioned whether these closures and cancellations are really necessary.
Well, joining us, University of Utah Emeritus Professor of Medical Ethics and Infectious Diseases, Jacobson. Dr. Jacobson, thank you for taking some time to talk with us. I wonder if you had time to listen to what the governor and those education leaders had to say, because parents around the state are thinking, wow, was this the right decision, closing schools? Do you have a comment?
I heard part of that, Spencer, and I heard the governor and health officials the other day in an earlier press conference, but I think closing schools is a part of a strategy often called crowd control or social distancing. So maybe we can talk about it as part of a larger strategy.
Well, you mentioned social distancing. That seems to be a new term that we're all getting quite accustomed to these days. Explain why social distancing is important to prevent the spread of something like COVID-19.
Sure, and I think we often use the term precautions when we're thinking about disease, and a quick way to think about it is if a disease is mosquito-borne, you use mosquito repellent, you wear long sleeves, and you may not go out at night if that's when mosquitoes bite. So that's a precaution. If a disease is transmitted by water, you bring bottled water and don't drink from the tap. If a disease is transmitted by people, you have fewer options. And so things that you can avoid are touching those people, especially in a way that would transmit the disease. So for respiratory diseases, kissing, touching their hands, touching your own face, eyes, nose, or mouth would be the ways that that's transmitted. So the precaution would be to avoid that. What's the most efficient way you could avoid that? It would be not being close to other people. At the extreme, it would be staying all by yourself with no contact. In the middle might be driving to work and maybe working with three other people in a large space. Probably the place that puts you at most risk is being really close to a lot of people for a long time. And I'm sure that's part of the thinking that led to the governor's decision.
And you know, we hear so much from people, so I want you to answer this question to help people see what the difference is. Flu kills tens of thousands of people a year. We don't take these kinds of precautions for flu. How is coronavirus different? Why is this something that is scarier to an infectious disease specialist like yourself?
So a couple things about flu. It wouldn't be a bad thing if we worried more about flu. It's actually an embarrassment that for a disease which is preventable with a vaccine, almost 3/4 of our public chooses not to do self-vaccination. This is a disease where many of those deaths are entirely preventable. So the first thing is to say we may be a little bit too cavalier about the way we think about influenza. So that may not be the best model. However, currently there are about 36 million cases of influenza in the US and 22,000 deaths. If we were to have the same number of coronavirus cases, we could be talking about 220,000 deaths, or 250,000 people. And if the epidemic was even bigger, imagine. We could be talking about deaths at the level of 1 million or more. So without any question, in terms of the potential severity of the disease, most estimates are this is at least 10 times more severe in terms of fatality, and maybe as much as 20 or more times. So that's one reason to take it more seriously. The other one is it's new. And some things about it are unknown, and all of us are frightened by things that are unknown and new. And I think that describes a lot of the public response and to some degree the public policy response.
I want a quick question. You mentioned a vaccine when it comes to the flu shot, and people are not getting it. There's a lot of work right now going into developing a vaccine for the coronavirus. Any hope on the horizon when it comes to that?
Oh, definitely hope. I think you used the right word. The challenge is expectation. I think that there's a high probability that the vaccine will be developed. The question is when, and at the time that it's developed, will we still need it? and none of us know the answer to that. But I think it's good to think that there are many things that are under intense research now. The vaccine is one, and there actually were some trials that began in Seattle in March. So that's very exciting, and they're being done and even skipping the step of animal experimentation and going directly to humans. So that's very encouraging for the time frame. But let's not forget that there are other things that can be done. There are several drugs that are being evaluated that may work against this virus, and there's the idea of immune serum, which we use when we don't have other treatments or vaccine. So I would say there are 3 opportunities that some form of treatment or prevention will show up pretty soon.
All right. Dr. J. Jacobson, Emeritus Professor of Medical Ethics, Infectious Diseases at the University of Utah. We've gone overtime with you because we just had too many questions. We really appreciate you taking the time and sharing your expertise.
Thanks for the opportunity.